When should your family history lead to colorectal cancer genetic testing? Imagine discovering that your family has a long history of health issues. When it comes to colorectal cancer, understanding your family history can be a key step in protecting your health. If you have several close relatives like parents, siblings, or children diagnosed with colorectal cancer or precancerous polyps, especially if they were diagnosed before age 50, it might be time to consider genetic testing. Having one family member diagnosed under age 60 or multiple relatives across generations with colorectal or related cancers, such as endometrial, ovarian, stomach, or pancreatic cancers, can also signal increased risk. Certain hereditary syndromes like Lynch syndrome or familial adenomatous polyposis are linked to specific genetic mutations. If a relative has been tested and found to carry these mutations, that information can be very important for your health decisions. Also, if you or a family member was diagnosed with colorectal cancer before age 50 or has multiple adenomatous or serrated polyps, genetic testing could provide valuable insights. Sometimes, tumor testing of colorectal cancers reveals markers like mismatch repair deficiency or microsatellite instability high, which suggest a hereditary syndrome might be involved. In these situations, consulting with a healthcare professional or genetic counselor is essential. They can help interpret your family history and determine if genetic testing is appropriate. Knowing whether you carry inherited mutations allows for personalized prevention strategies. These might include starting colonoscopies earlier than usual, having them more frequently, or considering risk-reducing surgeries in some cases. Even if your family history isn't strongly suggestive of a hereditary syndrome, earlier screening is still recommended. Usually, this means starting colonoscopy 10 years before the youngest family member diagnosed or by age 40, whichever comes first. If the initial results are normal, repeating the test every 5 years helps keep a close on your colon health. Overall, gathering detailed information about your family's health history, such as types of cancers, ages at diagnosis, and how many relatives are affected, is vital. This information guides your healthcare provider in making personalized recommendations. Remember, each person's risk is unique, so talking with a healthcare professional or genetic counselor is the best way to understand your individual situation. Following current medical guidelines, this approach helps identify inherited risks early, enabling targeted prevention and better colon health for the future.